I want to discuss rheumatoid arthritis. Rheumatoid arthritis is a chronic destructive disease of the joint. It classically involves the small joints of the body, hands and feet first. It affects women more commonly than men. It starts in the six decades of life and affects under 1% of the population. I want to discuss rheumatoid arthritis. Rheumatoid arthritis is an inflammatory kind of arthritis. It is due to the immune system reacting against itself, resulting in inflammation in the joints. When inflammation is left untreated over time, it causes damage to the joints. So people over time get deformities, especially in the hands and feet, and lose physical function. The most common complaint is pain in the joint. Inflammatory pain that occurs with rheumatoid as opposed to osteoarthritis is characteristically marked with joint stiffness. The stiffness is worse after joints have been rested and first thing in the morning. Next is a complaint of joint swelling and loss of function of the joint. Often it is in the hands, and the hands are painful. Typical joints are the knuckle joints, which become inflamed, swollen, and are stiff in the morning. Some patients learn they have become weak and not able to function as well as they did in the past. For treatment, we use a combination of medications. Simple analgesics like acetaminophen can be used, but these medications treat only the pain. Non-steroidal anti-inflammatory agents like Motrin Relief can also be used to treat the symptoms of stiffness and swelling, but don't affect the processes of the disease. The treatment of rheumatoid arthritis has changed drastically in the last 2 decades. DMARDs are disease-modifying anti-rheumatic drugs, and they treat the underlying cause of the disease rather than reducing symptoms. It is important to start DMARDs early because there is a window of opportunity when the disease is more responsive to treatment. When we treat within that window, we have a better chance of stopping the damage to the joints and getting remission. We have a new class of drugs called biologic agents. There is a movement to use these drugs earlier. The problem with these drugs is that there are side effects and can be expensive. We like to use these biologic drugs because they have been more effective than disease-modifying agents and in most cases can stop the destructive process that underlies rheumatoid. In patients who have evidence of the likelihood of damaged joints and even in early treatment, the most commonly used disease-modifying drug is methotrexate. That has been used for over 30-odd years in rheumatoid arthritis and is a very effective drug. There are 4 to 5 other disease-modifying drugs. These drugs, by definition, slow down the process of damage, can be very effective. Once diagnosed, it is the diagnosis that you must live with for the rest of your life. It can go into remission with no symptoms, but are on drugs. If we stop the drugs, all evidence suggests that the arthritis will. Thank you.